Hey guys, this is my topic for this week. It's nephrotic syndrome. Sorry about the silver marker, I'll get closer in a second. I just wanted to go over what it is. It's actually damage to the blood vessels, those tiny capillaries in your glomerulus, in your kidneys, allowing things that you need to be filtered out in your urine. So let's take a closer look. So here's your kidney. I just drew out the pyramids, just show you where the glomeruli are up here in the cortex and the top of the medulla. So this is where they are, and I drew a little Bowman's capsule. That's easier for me to say. So I just wanted to show you, this is the capillary coming in, it twists around, and this is where your blood gets filtered and we get rid of things that we don't need. So in nephrotic syndrome, what's happening is your body the capillaries are damaged, so they're letting out proteins that we need. Albumin mainly is going to get filtered out into your urine, so that's not good. And I'll tell you why. So signs and symptoms are anasarca, which is profound swelling. It's a lot in your face, your eyelids. You can definitely tell people who have this going on. It's definitely worse in the morning. It seems to resolve slightly throughout the day. Also, you'll have, with the anasarca, you'll have like pitting edema in your legs and feet and ankles. You're gonna see foamy, frothy urine. It's because of all the protein in it, it makes it a distinct foamy urine output. You're gonna have decreased albumin because it's getting excreted out into your urine, and you need that, and it's gonna cause the fluid shift into the tissues, which is what makes that swelling. You are going to have an increase in lipid and triglycerides because your liver is going, hey, what's going on? Why don't we have enough albumin? So it starts to make it. It also makes lipids and triglycerides, and those go into your blood, and those don't get filtered out, so then your levels are going to go up. So it's creating a perfect storm. You're going to have hypertension secondary to the fluid overload. You could get blood clots because along with the albumin, the clotting proteins that you need are also excreted. Let's see, you're at increased risk of infection, of course, and weight gain due to that fluid retention. To get diagnosed with this, you'll need a urine test. If they can get it, if it's not an emergent situation, you can have a 24-hour urine. Blood work is going to show hypoalbuminemia, low albumin protein in the blood. And then you could also have a renal tissue biopsy, which is they put a needle in and take a little bit of tissue and look at it under a microscope. Let's see, risk factors. This is usually due to diabetes, which professor said it seems like diabetes is the root of all evil. And it affects your kidneys. That's why it can cause scarring, just like lupus. A lot of NSAID use with diabetes can put you at risk for nephrotic syndrome, and also infections like HIV, Hep B and C. It can just add to your risk factors of developing this syndrome. Let's see. For treatment, we have to treat the underlying disease. It can be blood pressure meds, diuretics, statins, anticoagulants. Sorry, I put warfarin. I wrote the digoxin and rivaroxaban, sorry, for Xarelto and Pradaxa. I tried to write the NCLEX names. And immune suppressants if it's lupus is the underlying cause. Quickly, sorry, I'm getting close to 5 minutes. So diet would be, of course, low cholesterol, low salt, because you got so much fluid on board, and your lipids are going to go up. So like they can also do that. You can adjust that with diet. along with other treatments with meds. Daily weights, urine output, the color, consistency, is it frothy, is it getting clearer, are they having pain, the diet that I just spoke of, and INOs. And quickly, life threats, acute renal failure, sorry. They may need emergency dialysis because of all the toxins building up in their blood. And that's quickly the overview of nephrotic syndrome. Thank you.